As healthcare continues to evolve, I think second opinions have become very important. It's really about informed decision making, and this allows patients to make better decisions about their health.
I encourage my patients to get second opinions. I not only encourage them if they ask, but also help them figure out where to get the second opinion.
It's often thought that if you are asking for a second opinion, that the physician that's treating you will feel insulted somehow. Well, I think there may be some who are like that, but most physicians are not so insecure. They all have reached out to other subspecialty areas for help when they need it.
A way to communicate that to their physician is to simply say, you know, I've known you for a long time, I'm happy with the treatment that you've afforded me for several years, and I just want to get some additional clarity, and I'm thinking about getting a second opinion. I was wondering who you would recommend and where you would recommend me go.
If you are in a community setting, and if you have a rare or difficult diagnosis, one that can significantly impact your health, I think you should really consider getting an opinion at another institution, preferably an academic medical center or a larger hospital where they may see a greater volume.
Seeking out an opinion from an academic institution is a great idea because you can possibly be enrolled in a clinical trial where they have the most updated medicines for you.
When a patient comes for a second opinion, the most important thing is to bring the first opinion. Make sure that you have all of the evidence with you, and make sure that you have the images as well as any reports of any tests, as well as the clinic note or the letter, a referral letter that will actually detail what the history is. It's very helpful.
I think it's always good to go in with a list of questions. That exchange can be very quick, and you may end up leaving out pertinent questions.
Definitely ask about pros and cons of treatment, what impact it will have on your particular day-to-day life, what you can expect from the treatment.
There are times when the two opinions may be divergent, and that can be very confusing and stressful for patients. And so I think in this case, weighing all of the facts, and if deemed necessary, maybe even think about a third opinion.
A lot of times that's going to come down to the rapport that the patient has with the physician and whether or not you can, best you can assess it. The treatment or the procedure is based on evidence.
Whenever I do see a patient, I absolutely let them know that they have to feel comfortable with their doctor.
It's not a slight for us if they choose to go to another institution. We need to see ourselves as facilitators in that patient's decision-making, whether or not they stay here.